Okay, hello to everybody out there. Thank you guys for joining us this afternoon. My name is Tim Greene. I'm a sports medicine specialist at ONS. And today we're going to talk about injury prevention in a virtual world that we're in. So this is a COVID talk, but it's not necessarily, a talk about if you get COVID, how do you exercise? This talk's going to be about how do we safely exercise in the restrictions of a virtual COVID world that we're in. So we're going to get kind of in depth about the things we've seen over the past year and the problems of exercising and doing a lot of the exercise at home. There's a Q&A bar on the Zoom tool here. So if you guys have questions, you can just type the questions into the Q&A button. And then at the end of the presentation, I'll go back through those and we can answer those. So over the course of this past year, we've seen a lot of really consistent injuries, and they're really not that much different than what we've seen, over the long course of time. They've just been a little more prevalent. They're not traumatic injuries. We haven't really had organized sports from the restrictions. They're more of stress and overuse injuries, and they've come very, very consistently. And these really stem from two main things now. And a lot of us have been in a virtual workspace. There's a lot of Zoom. This is a apropos talk as it's virtual. There's been a lot of Zooming like this. And what that does is give us some concentrated sitting. So you might say, well, I have a job where I normally sit. I think what we've seen out of a lot of people over this time frame is it's more concentrated sitting. We don't necessarily have the commute. We're working kind of all at once. We're not getting up to go to a meeting or to change to go meet somebody else, to talk to somebody else. We're all doing it, on a computer. And so that may not make for sitting as long period of time, but it's definitely more concentrated. And then what we're going to get into with that, if you can just see, over here, they almost look like crash test dummies, but my two little guys about their sitting positions. And some of that concentrating sitting we'll talk about, it's done at home. And a lot of this, we may not be quite as set up as well at home as at work. We might be at a kitchen table. We might be bringing over a chair, that may not be a great supportive chair. And so some of these issues we're going to see come directly from sitting. The other issue, which actually seems like a great thing, is a lot of us have had a little more time for exercise. So, it's one where we may not have that commute. So we may get extra time, on either side of work. So we have way more time for exercise. But some of the problems we see is with more time comes more exercise and comes more volume of exercise, which sometimes can be too much, and sometimes combined with some of the issues we're going to see from sitting. And then, we've had a lot of restrictions. Gyms have been closed. So, a lot of people's normal exercise routine have been different. They've had to do new things or different things. And sometimes those exercises have caused more stress over time. So we're going to really get into these two, and then the combination of these two, which are some of our problems and issues. So if we think about sitting and sitting a little bit more for a concentrated period of time, sitting, the problem with sitting is that it slacks a lot of our musculature. So if we think about the things when we sit that get shortened or get slacked, they're a couple of muscles, and these are the muscles we're going to concentrate on. So the hip flexors, so if you can kind of see on the arrow, are these muscles. They come from the lower abdomen and go over the front of the hip. They get shortened when we sit. The upper quad muscle, which is actually not here, but it would attach right over the socket. And then there's the IT band, the kind of notorious IT band from runners, where we see it go over the side, from the hip to the knee. It has a little muscular portion to it. And then underneath these, as you'll see here, the deep glute muscle. So not your bigger butt glute muscle, but the deeper glute muscles underneath it. And those are really important because things like running are mainly supported by these muscles. Every time we walk, these muscles hold our pelvis up when we run 4 to 6 times our body weight go through these muscles. So they're important ones. So when we sit, all those muscles in the front, so the glutes in the front on the side, the hip flexor, the quad muscles, they all get placed on slack and they shorten and they can get tighter over time. So if we take concentrated sitting and add that to our normal activities of sitting, such as we sit, we eat, when we sleep, we ball up in the fetal position a lot of times, and driving, all those sort of things added together get those muscles, as they're shortened, tighter and tighter and tighter over time. And that becomes a problem, right? So the issue is that as those muscles get tight, a tight muscle can't take as much load before it fails or starts to become more irritated. So the less pliable it is, the more quickly it is to get irritated or fail. And that becomes a problem, as we're trying to do more active things. The IT band itself, which is that band on the outer side, actually sits above the muscles, particularly the glute muscles on the side of the hip. And as it gets tighter, it rubs and creates friction and irritation. So the other problem is we naturally all get a little bit stiffer over time. And then probably the biggest problem is that none of us really like to stretch that much. And you see that all throughout time, but it makes a little bit more of a difference when we're sitting a little bit more. I've seen maybe thousands of runners over the time, and I can tell you one absolute consistent thing between runners is that if runners have 45 minutes to run, they're going to run for 45 minutes. They're not going to run for 40 and stretch for 5. And that's a lot of, as we go through this, is just kind of going back and figuring out how we can kind of take care or head off some of these issues just by some simple stuff. And particularly, we'll get into the stretching there. So there are issues in the upper body as well. So not just the lower body. And these, with concentrated sitting, become more with postural issues. And I think everybody probably finds themselves doing this no matter how good their posture is, but you're sitting on a computer and you end up kind of progressively slouching forward into the keyboard. And what that does, it places stress around the neck muscles, the shoulder, and it can actually even cause inflammation in your rotator cuff and your shoulder down beneath or below. And if we just kind of go back and look at this example of, here is this kind of slouch position, right? So arms out in front, the shoulders are a little bit more forward and elevated, and then the neck moves forward, and we kind of get into that poor posture position. That puts a ton of stress on these muscles behind. So the neck muscles and the trap muscles behind. And then this forward position of the shoulder, which will kind of be in here, what you'll see, I'm going to show you two more pictures just to illustrate that. So this is a picture of the shoulder looking at it from the side view. So the ball is here around that little H, and then the socket is behind it. So this is the front of the shoulder and this is the back. And normally there's a big open space here. And that is a space that, if you look at the other picture, is a space where the rotator cuff muscles come through. And so this is down with the arm at the side. The problem is, as the arm gets more forward and it lifts up and forward in that kind of slouched position, that area of open space where the rotator cuff is gets narrowed. And you can kind of see this rotator cuff underneath can get pinched in this area. So not only in that position can you pull on and aggravate the muscles in your neck, the shoulder blade muscles, that, the trap muscles that go down there, which is very common. You can also get some impingement, some inflammation in your rotator cuff just by being in that poor postural position. So, if we think those are the bigger issues with just posturally, how we sit with tightness. So if we think about the second problem, is our exercise, and it's increased exercise, which is great. I mean, I think we all look for more time to exercise and do those things that we like. The problem sometimes that comes in that is if we add too much exercise too quickly. And if we combine that, I think, with tight muscles and tendons, those become a real problem, because you get the muscles and tendons that are inflamed, they're a little too tight, they become weak. and they no longer can support the joints or support the bone, and they get really overstressed. I mean, you can see people that have never had a problem. They maybe have just a little bit of wear and tear arthritis in a joint, and now they go out and run, and they've been sitting for long periods of time. Those muscles have gotten a little more contracted, and because they're a little bit more contracted, they become a little more weak. And then as you're pounding that joint, it can no longer support it. So you start to overstress, and maybe those little areas of wear and tear become more inflamed. This is the same thing that happens with stress fractures. It happens in the bone from time to time. If you don't have that strength and you pound it and you're no longer protecting it, if you think about it like shocks on a car, then you can overload that and have a stress crack or a stress fracture in there. So, uh, increased time for exercise, always great, but sometimes it's the way we do it, and we'll talk about that a little bit as we go forward. So the other thing is, if we talk about not only increasing exercise, the other issue is what exercises are we doing? And this has been different, over the course of time. Gyms have been closed. The typical exercise programs that we're used to, we haven't been able to do over a period of time. So we've kind of gone back into either doing new exercise, whether that's in the spring and the summer, going out and running, and it may be something they haven't done for a while, or it may be something new. You're like, okay, I have this time, I'm going to run. Those sort of things can be problematic, again, done in an area where things may be tighter and where you're adding a lot more very quickly to it. The other issue becomes is what other exercise you're doing. And so you'll see people that can't go to the gym. I'm going to start, some virtual classes, some online classes, and just not knowing what kind of exercise that is. And sometimes they end up being HIIT classes and a lot more impact than maybe you're used to. And that's really problematic, again, when you have muscle tendon tightness and irritation that underlies it. So this is really kind of where it boils down to. Over the past year, we've seen a lot more issues with this combination: tightness and weakness from sitting really too much, particularly in those hip muscles, and then some in the shoulder, which cause more pain and more weakness and irritation around the shoulder. But having that tightness, having weakness, and then really doing a lot of impact exercise on top of that. So if we add way more exercise, and even adding new types of exercise of more impact, that's really produced a lot of very consistent stress injuries that we've seen: pain around the hip, pain around the knee, weakness and tightness, and really has stopped a lot of people from exercising completely. So how do we prevent this? And none of what I'm going to tell you is groundbreaking, but there are going to be little things that we can put together to keep us exercising in the right way and prevent these little bit of injuries until we get back to more normalcy there. And really, a very, very simple thing is how you sit, and how you sit at the computer, doing more computer work, even as we go back to less concentrated sitting and back to our normalizing computer. But there are some simple postural things and ergonomic things that you can do to prevent that. And so, kind of first thing is just making sure whatever monitor you're looking at is really kind of at eye level, and you're not looking down at something on a phone or tablet, which again creates that stress over the back of the neck. And then also being supportive at the way that you use your keyboard. So using a chair that has those arm lifts so you can kind of rest on them, and bringing the keyboard into you so that, these arms are really more at a 90-degree position. They're not reached out in front where we'll see that area for the rotator cuff where it gets narrowed, where we kind of slouch and reach out in a forward position. And then thinking about kind of how you sit, and really being able to sit at not a really low position. The lower the position is, the more flexion comes at your hips, the more those muscles slack. So one, thinking about sitting a little bit above 90 degrees, so where you're not sitting way down or deep into it. Sometimes we'll see people doing some virtual stuff around the couch and you're sitting cross-legged. And again, those sort of things do produce a little more slack in the muscle and will make it a little more tight over the course of time. So these are just some ergonomic kind of postural things. Some people use standing desks, which are good, for these sort of issues. You just want to make sure on that standing desk that you really don't have any of these sort of irritations before that, because being on your feet with some irritated weak muscles, those actually become problematic in a standing desk sort of scenario. So again, simple little postural things, thinking about how you sit and address yourself working virtually. And then it's just thinking about really, there are going to be times where we have to sit. It's part of normal life. But the things that we don't do well are stretching in and around our exercise. And so just kind of coming back and thinking about each one of these little areas that tends to give us problem. And what we're going to do is go through some very simple stretches that you just have to do. And if you do them, and we do them consistently, and this is something, as we think about it, it's holding some of these stretches for a minute at a time and just doing it on a consistent basis. And it really will make a big difference. And again, these are the muscles we're going to think about: the hip flexor muscles that come from deep in the belly over the front of the hip, the quad muscle, which the upper portion of that goes right over the hip, the IT band on the side, iliotibial band on the side, and then under that, the glute muscles, right? So the smaller glute muscles, again, not the bigger buttock muscle, but the glute muscles underneath it. And again, remember, we sit all these things slack. So very simply, the hip flexor stretch, that can be standing, it can be kneeling down on one knee, but really what we're getting is some of that. We're getting the upper quad muscle, we're getting the hip flexor, you're getting some of the lower abs in that. And just to pick one of these, it doesn't really matter. You can get out of your chair, kneel down, do it in a standing position if that's easier. And again, these are simple, just 1 minute holds in these exercises, and even something that simple really can help. If we think about just the quad stretch, right? And this is going to get the lower quad, so not the upper quad, at the hip. It's going to get a little bit more of the lower quad here. And you can just back up from your chair and use your chair to do it. You can do it this way with a little pad, knee on the ground, foot in your chair. That's going to get a little bit more of the upper quad and a little bit of the hip flexor with that lower quad, just on the variation of that stretch. Cobra is an easy one. That's a little bit abdomen, but it's also because your hip flexor does come from your lower abdomen, it will help from the hip flexor itself. And then we start thinking about the IT band, and they're going to be the same sort of stretches that we're going to use to stretch those small glute or abductor muscles on the side. And this can be done in a couple different variations, right? So we can take the affected side and cross that underneath or behind the other leg, and then really just lean into it. You can do the same exact thing with the chair, even the chair that you're sitting on for work. And that just produces a nice stretch out of the iliotibial band and those outer hip muscles. You can actually reach towards the floor. So you can, lean your hip away and then reach towards that opposite side. So this is the leg behind in this picture. They're reaching to the opposite side. And that just stretches it in a slightly different area. And then very simply, and these are good IT band stretches, is just crossing your leg and doing it in two different variations. So the one on the left is leaning forward, and you could even take your hands and reach towards your feet so that your forearm bones or your forearms are really on the front of your shin bone reaching forward. And that one, you'll feel a big stretch from behind, and then you can take the knee in that same seated position and pull it up towards your chest. And those are really great classic stretches for your iliotibial band, and will really help loosen up the iliotibial band. And so those are very simple stretches to do for the lower body, and particularly the things that are going to be problematic for sitting. For you runners, that IT band and those glute muscles on the side, and then kind of secondarily the hip flexor, are going to be the big problems, right? Those are the things that are going to be weak and irritated. And as you start to run, all your body weight comes down on those muscles. They're aggravated and they don't work well. And then a lot of times when they get worked well, they don't even cause hip pain, they can cause knee pain sometimes. So really important to be more mobile in those. And then as we come back and start to think about the upper body sort of issues that we come with, and again, it's this bad postural kind of crouch position, which we can fix in a better postural position. But some of this, what can help is a little bit of stretching the trap muscle and those neck muscles, and this is a nice stretch where you just lean your head to the opposite way and rotate it down. If you put your arm behind you, it gives you a little bit more of a stretch through the entire trap muscle all the way down. And that's a nice stretch to do for some irritation in the back of your neck. And what can be very helpful in keeping us, so on the left, this is the correct postural position. Those shoulder blades are back. And then I think I do this sometimes myself sitting on a stool. You find yourself just kind of floating and posturally like leaning forward. And sometimes that comes over a long day because we fatigue, and we fatigue out of those back muscles. So those trap and upper back muscles behind the shoulder blades, some people get a lot of pain in their shoulder blades from that. So this little simple rows where we're kind of in, these can be with bands, something very simple. These rows where you pull back and hold in this really flex back position, and just to give these muscles endurance. These are sets of 15 at a time for 15 reps at a time, really holding them and working through that over a couple of 3 sets can be really helpful with keeping us out of this poor postural position that really starts to aggravate the back and upper shoulder and the rotator cuff. So really simple stuff. None of this is complicated. A lot of it is just putting into practice a little bit. So we think about, again, the postural, the ergonomics of sitting, the right way to sit, really managing what you're looking at, your arm and shoulder position, and the height of where you sit, where we're thinking about trying not to flex the hip quite as much. Stretches are so simple. They're just sometimes hard to get going and doing. A lot of these sort of things is just getting started in it enough that it becomes a little bit of a routine. Those were really only 5 or 6 stretches. And they're the most problematic things in particular for running and sitting with running. So if we just could build up a little bit of that's the routine, either sometime in sitting or at the end of sitting. And a really good point is if you're out and you're doing a little exercise or running, those exercises are great right at the end of running because you're already loose, you're already warmed up, and they really can gain a lot more mobility. You can get better gains in those over time. And then the last thing to kind of think about is our impact exercise. So adding to those couple things that we talked about is just thinking about how much impact we're doing. And if it's something new, we have to build it up a little bit over time. I think when you see very typically when people go back into things, we'll see it often, as people go back into certain sports they haven't done it in a while, the amount of impact that comes very quickly oftentimes inflames or aggravate things. So building up slow and steady, particularly if you haven't done it in a while or you haven't done it before, just to make sure we don't get any overload. And if we're doing online classes, know what you're doing, know what's in the class that you're doing, because then you know how much impact to manage in that. Don't be afraid to modify it at first in that impact. And the real issue and why we really have to think about and do these sort of things, because by the time you get these stress injuries, by the time you come into me, it's really rest. The only thing that gets these things better are rest. And then we go back and we start stretching and start building the strength again. And that takes time. It's the one thing that no one wants to do or has, even though we definitely have more of it. It's always like, when can I get back to the exercise? But the problem is you have to get all the stress going. So we want to really be ahead of these stress problems and injuries by watching how we sit, really paying attention and adding into some stretching into our routine, and then just making sure we're not overdoing it from an impact exercise. And so it's pretty simple in there. And it's just things that sometimes, I think, as I've seen people over the course of the year, and I've seen more and more and more of these problems, people just don't realize that what they're doing. And I've had this conversation maybe 300 times, over the course of this year with people of like, they don't really recognize that they're even doing this, and they didn't know that thing was weak. They didn't know it was really tight because you don't recognize as much that you're doing it. So just adding these couple of little simple things, I think, can be really, really helpful. And again, not overly onerous in adding more to your routine and adding more to the time where you want to do things, but just the simple things here will make a big difference. So I'm going to go for, if anybody has questions, I'm going to go into the questions. Some people have already put in there, and I'm going to start reading and answering some of these questions. So if you have any questions, just write them in to the question and answer bank there. So I'm just going to start reading some of these. So the first question is, I've started exercising very actively 5 to 6 times a week. Was not active pre-COVID. I do seem to have a weak left knee where I have pain occasionally. Any recommendations on whether I should wrap it or wear a brace before exercising? So I think one of these sort of things is, what's important with that is, a lot of times, and you've seen this very, very consistently, you do have to think about your hip a little bit in this, particularly if you're running during that. A lot of times you can have some weakness in your hip, and that weakness you may not even really know that you have. So again, the stretching portion of your hip, sometimes just doing some little band exercises, where you're kind of laying on your side and the knees are bent, with a little band around your knees, helps strengthen that. And then that generally will help. It definitely can use, if you're having pain around your knee, you can use a little compression brace. Sometimes that's helpful too, in just supporting it. But it's one of these where, you have really want to just think about, there may be other things causing it, and we'll see that very, very consistently. So just make sure that, you're paying attention to your hip, even though it may not be a very painful sort of thing. It may be a part of the issue that's going on. Okay, so, all right, more questions. There was a question, will this talk be available to send to family and friends after it's over? I think this is a recorded. Cindy, can you answer that?
It is recorded and it's available on our website. You can send the link to your family or friends.
Okay, perfect. So any other questions? Happy to answer.